There we go. Good evening, everyone. Congratulations to our graduates. Graduates, you may be seated. Welcome to Roseman University of Health Science College of Nursing, ABSN June class of 2023 pinning, and the January 22, December 23 MSN Family Nurse Practitioner White Coat Ceremony. I am Dr. Brian Oxhorn. I am the Dean of the College of Nursing. And this is a great day for all of us. As educators, this day represents the outcome of the sharing of our knowledge, skills, and attitudes to both our entry-level and advanced practice nurses. As families and loved ones, this day represents the fulfillment of dreams and aspirations of those closest to you. For some of our graduates, this day represents socialization into a profession dedicated to the needs of others and improving the human experience. For others, this day represents an expansion of their scope of practice to improve health outcomes for patients and populations and provide needed health care services to the fullest extent of their capabilities. This is also a good day to remember your why. What is your why? These are the beliefs or values that you hold that led you to our profession. Don't lose your sight of purpose for working so hard and sacrificing so much over this past 16 months to 2 years, depending on which degree you're in. Today, you are no longer student nurses or student nurse practitioners. You are now graduate nurses and graduate nurse practitioners. And for those of you who aren't nurses, that is an important distinction for us. It's a milestone, trust me. Over the next few months, however, one by one, you'll be calling yourself registered nurses or advanced practice registered nurses. As you embark on your next chapter, return to your foundation of your why. Begin from that point as you develop and grow in your nursing career. Allow the how and what you do to be a reflection of what you value. I welcome some of you to our profession, and I welcome others to the role of provider. I am honored to have been a small part of your journey, and congratulations. I do send best wishes from both Dr. Renee Kaufman and Dr. Yukari Nadi, the president and chancellor of the university. Neither one of them were unable to make it here tonight, and they apologize for that, but they wanted to send their best wishes to you all. So now let me welcome and introduce the College of Nursing faculty and staff. These group of individuals have dedicated their time and effort to provide these students with the education they need to practice safely in whatever clinical area they choose. Please stand as I call your name. Starting on the stage, we have Dr. Shanda Clark, Assistant Dean of Curriculum Assessment. Professor Ellen Eversole. Dr. Federico Calixtro. Professor Robert Fox. Professor Stacy Smith, Assistant Director of Clinical Resources. Professor Esperanza Obasi. Professor Stephanie Maston, Assistant Director of the Lab. Professor Georgine Krieger. Dr. Jennifer Morris, as of like 2 weeks ago. Professor Chantel Jackson. Professor Eliza Michelle. Professor Dorshay Dean. Dr. Tamara Carley. Dr. Mary Faye Axon Armstrong. And Professor Marika Chunik. And for the staff we have here today, we have Miss Anna Guevara, who is our MC coordinator for the evening. We have Miss Christine Russell out there somewhere, both administrative assistants in the College of Nursing. Miss Nicole Martin. Miss Nori Daza. Dr. Eric Dillon, our Director of Admissions. Miss Francia Garcia on camera 1. Miss Annie Ortega on camera 2. Somebody's hiding here. Miss Anya Reisert from Admissions. Miss Belinda Schultz from our HR department. And Miss Donna Laffey, our clinical coordinator. Henderson. And I think that's, back on the IT guy back there, Jason Gibson, he's also from Roseman. He's live streaming this for you guys, for your family who can't make it here tonight. And please, welcome, round of applause to all of our student volunteers who help coordinate and help manage crowds and stuff. So thank you. Your turn is soon. So with that, please let me welcome to the stage Professor Ellen Eversole, who will read the tradition of the pinning ceremony and lighting of the candle.
In the 1860s, Florence Nightingale devoted herself to caring for casualties in the Crimean War. In recognition of her service, she was awarded the Cross of St. George. Florence then extended the honor by presenting a Medal of Excellence to the most deserving student graduates at the Nightingale School of Nursing, London. Today, nursing schools around the world give a nursing pin to represent a Medal of Excellence to their student nurses upon graduation. The Roseman nursing pin is designed in the university colors of burgundy and silver. The shape of the pin symbolizes the unique block curriculum of the Roseman program. Each side of the pin represents the College of Nursing core values: service, integrity, innovation, and knowledge. The lamp of knowledge on the lower half of the pin signifies the nurse's science-based knowledge and commitment to lifelong learning, which are foundational principles of professional nursing practice. The lamp was a symbol of the care and devotion Florence Nightingale administered to the sick and injured in the practice of her nursing. After nurses were pinned, Miss Nightingale would light a lamp and pass the flame to each nurse as they said the pledge. Today, we carry on the ceremonial tradition, passing the light.
All right, please welcome to the stage the June class of 2023 class speaker, Miss Maria Maybelline Cantos.
Good evening, everyone. My name is Maria Maybelline. First, I would like to thank God for placing me on this path, and to our professors, faculty, and clinical instructors for providing us with the knowledge and foundation that we will need to carry out in our careers. To my love, Carl, thank you for supporting me and keeping me sane throughout nursing school. And to my family and friends that continue to stay in my corner and have shown up when I needed them the most, thank you. I am honored to be speaking on behalf of my cohort and fellow classmates tonight as we close this chapter of nursing school and say goodbye to those ATI exams. I want to start off by saying that nothing can prepare you for nursing school. The amount of caffeine you need, the weight you may gain or lose, and the hours of sleep you won't be getting was not in the student handbook. I remember applying for nursing school and getting waitlisted. I would get discouraged and feel like I was just wasting my time. Finally, I got accepted to Roseman University. I was so happy yet so scared to start this chapter of my life. I think my classmates and I all felt the same way at one point. We all had to sacrifice something to be where we are today. Some of us had to sacrifice missing out on social gatherings, moving away from home and leaving our friends and family, working a job or two, missing out on their kids' first day of school or a friend's wedding. I can keep going, but the list goes on. These students in front of you today have gone through so much together these past 17 months or so. We call it trauma bonded. Why? Well, if you don't know about Roseman's 90% or fail rule, basically you have to pass every assessment with a 90% or you fail. So the first time I didn't hit that 90% was probably a couple months into the program and I felt defeated. I thought nursing school wasn't going to be for me and it was just so embarrassing to have to retake that test. I felt like I was going to be judged and I didn't know I was going to make it through nursing school with such a high expectation of passing every class exam with that 90%. Well, here's one thing I learned. Life happens. You're probably not just a good test taker or you're just so tired from studying that you couldn't focus on the tests, so you failed. However, the difference between failing and choosing to try again even after a failed attempt shows resilience, and that's what these students all have in common. I had countless mental breakdowns, and I actually thought about quitting. I thought about quitting a lot. I juggled school, extracurricular activities, work, social, and family life. It was all overwhelming, but it fueled me enough to where I stand today. So graduates, whatever has fueled you to get where you are today, I hope you continue to have that fire within you. We've learned that success is not measured solely by grades or by getting that 90%, but our ability to adapt, persevere, and keep moving forward. But it's not just about the knowledge we've acquired in nursing school. It's about the qualities that will carry us through. It's the empathy that allows us to connect with our patients, the resilience to face challenges head on, and the unwavering commitment to the well-being of those under our care. Our profession requires not only medical expertise, but also the ability to hold a hand, to provide comfort, and to offer hope. Each patient we will encounter will be a new chapter in our story, a life that we have the privilege to touch. We must remember that the impact we make is immeasurable and the difference we can bring about is profound. Your sacrifices have brought you to this moment, graduates, and they will continue to shape your path as nurses. Life is a journey, and every experience, whether it's a success or a setback, is a stepping stone toward personal growth and success. Thank you and congratulations to each and every one of you. May you all thrive in all your endeavors and be the reason someone is happy and healing today. Set your heart ablaze. We did it.
All right, now the moment we're all waiting for, the pinning ceremony. Dr. Shanda Clark will read names, and Professor Ellen Eversole will hand out the candles.
Yeah, they're going to hand me cards. Oh, but that's right. Yeah, I know. Hind al-Shamari, being pinned by Gada al-Frey. Angelica Aquino, being pinned by Abigail Morris. Renee Teresa Belisi, being pinned by Anthony Belisi. Sarah Bean, being pinned by B. Amenta. Taylor Becker, being pinned by Christian Cota. Marielle Beltran, being pinned by Alexandria Lacantoso. Caitlin Bledsoe, being pinned by Ethan Bledsoe. Natalie Brown, being pinned by Denise Brown. Maria Mabelina Cantos, being pinned by Carl Torres. Gabriela Cardenas Felix, being pinned by Carmen Felix. Patricia Carrasco, being pinned by Maria Carrasco. Nina Katag, being pinned by Nariza Katag. Julia Cook, being pinned by Janine Young. Alexis de Guzman, being pinned by Martis de Guzman. McKenna Delaney, being pinned by Dale Delaney. Mary Therese DeMano, being pinned by Ruby Cantillas. Ginger Dunton, being pinned by James Robert Dunton. Claricella Felias, being pinned by Claro Diazon. Malik Clan Fortich, being pinned by Raquel Fortich. Danielle Gonzalez, being pinned by Antonio Gonzalez Anaya. Anna Maria Grigor, being pinned by Matthew Johnson. Vin Ha, being pinned by Lien Ha Tran. Sorry. Brittany Hart Hanish, being pinned by Lauren Hanish. Allie Hayden, being pinned by Kristen Hayden. Tyler Hernandez, being pinned by Cynthia Hernandez. Tal Himel Baloo, being pinned by Bar Himel Baloo. Catalina Ivan, being pinned by Cameron Stan and Mara Stan. Veronica Jaramillo, being pinned by Elvia Jaramillo. Jose Inigo Jimenez VII, being pinned by Regina Youngerman. Erica Johnson, being pinned by Cheryl Nunali. Sin Yu Kwan, being pinned by Eric Lamb. Jason Lewandowski, being pinned by Sonia Lewandowski. Lily Lowe, being pinned by Belia Lowe. Matra Mandavi, being pinned by Forzana. Chandler May, being pinned by Kelly May. Crystal Mendoza, being pinned by Irma Mendoza. Melissa Montoyer, being pinned by Sophia Martinez and Lola Martinez. Amanda Nguyen, being pinned by Stacy Trong. Jessica Pabalate, being pinned by Kalia Kanda and Jonah Kanda. Erica Pareda, being pinned by Eden Vitug Pareda. Samantha Pete Paleo, being pinned by Woodrow Pete Jr. Katrina Reed, being pinned by Robert Reed. Aria Reeder, being pinned by David Reeder. Marinelli Rubio, being pinned by Daniel Rubio. Renzel Maurice Santos, being pinned by Eric Rail. Laura Strong, being pinned by Yvonne Strong. Crystal Thomas, being pinned by Edgar Thomas. Tara Tobias, being pinned by Carrie Tanti Yanko. Randy Walton, being pinned by Dennis Daniels. And congratulations, graduates.
All right, congratulations. And now we will commence the white coat ceremony for the MSN FNP students. So it is a privilege and honor to stand before everyone today to present the notable achievements of our graduate students. These ambitious students entrusted Roseman to provide them with a quality education that many of them already had come to know as Roseman alumni. I speak for all the faculty by saying how grateful we are and a sincere thank you. So with that, I would like to recognize the high achievement gained by these students as they are ready to embark on their career journey as advanced practice nurses. To signify this, a white coat ceremony will be conducted tonight that is symbolic of their career progression as a new primary care healthcare providers. The White Coat Ceremony is the oldest and most well-known program of the Gold Foundation. The Arnold P. Gold Foundation established the White Coat Ceremony in 1993. The first White Coat Ceremony took place in 1993 at the Columbia University College of Physicians and Surgeons. At that time, Dr. Gold was a professor of clinical neurology and professor of clinical practice. He noted that the existing practice of having students take the Hippocratic Oath at the end of the medical training occurred four years too late. In 2014, recognizing the vital roles nurses play in the healthcare team, the Gold Foundation partnered with the American Association of Colleges of Nursing to adopt a white coat ceremony of nursing. More than 360 of nursing now participate, and the number continues to grow. The Gold Foundation instituted the white coat ceremony to emphasize humanism in medicine. Like physicians, the white coat ceremony is an event that many nurse practitioner students take part to commemorate the nursing graduates who are to assume new roles in the advanced practice nursing. To symbolize this tradition, students are coated by their faculty members using the iconic white coat often worn by healthcare professionals, symbolizing the nurses' tradition to the role of healthcare providers. In addition to the white coat, students will be given a pin provided by the Gold Foundation that commemorates the white coat ceremony. Featured on the pin is a gold Mobius loop that symbolizes the continuous bond of trust, respect, and communication when ultimately humanism is to be the center of patient care. We recognize our graduates to proudly wear their pin as a reminder of their oath to keep healthcare human. So we would like to invite your Masters of Science in Nursing, Family Nurse Graduate Class speaker at this time, Ms. Abigail Velasquez.
I'm short. Okay. Thank you, Dr. Calistro, and congratulations to the BSN class. I promise you the blood, sweat, and tears, the many, many tears, will pay off very soon. I'm excited for you all. Well done. Now to my cohort, the MSN FNP class of 2023. Wow, we actually did it. Somehow while juggling full-time jobs and our personal lives. But thank goodness for that group chat, giving us a few laughs and talking us off the ledge a couple times. We pulled together, and look at us here. We finally earned the white coat and a few extra letters. FNP, baby. For most of us, this is it, but some will pursue their doctorates. Mom, Dad, I love you. I worked hard, but I'm done. Like, done. Beyond this milestone, we met even more in our personal lives. In our cohort, there were 3 engagements, thankfully 3 weddings, and 2 beautiful babies were born. I'm so proud that we didn't put our lives on hold. Today's achievement may change our professional titles, but not our true identities. As nurse practitioners, there will always be a demand to care and treat others in whatever field we each pursue. But as daughters, sons, spouses, and some of us parents, this comes first. It is this identity that gives us the backbone, the joy and meaning in our lives, because we must first remember to take care of ourselves before strangers. Everyone sitting behind us and on the live stream, hey, is a testament of who we really are. Thank you to our friends and families for having our backs. Sure, we added another credential to our names, but let's remember our first and last names, the names our parents gave us, and from our spouses. We represent this first and foremost. To our support teams, today is your accomplishment as much as it is ours. Thank you for celebrating with us and for all you did to get us here. We are forever grateful. Another title I received during this program was becoming a mother. I delivered my beautiful baby boy 3 days after my last day of our first clinical rotation in adult family practice. Yep, at a whole 39 weeks and 3 days pregnant. Not cool. Swollen feet, waddling around everywhere, peeing every 15 minutes, but I held on. Barely, but I held on. At 9 months pregnant, all anyone should be allowed to do is lay in bed all day with their dogs, get foot massages, watch Netflix, and eat cereal. I would often tell my husband, "Are you making an eyeball?" Son, I hope you learn from my actions and not just my words. I promise you, as long as you give nothing less than your best in everything you do, you will find success, whatever that may be. Thank you to my parents and sisters who were there to help watch our son during the long hours studying and charting when all I wanted to do was play with Benny. It was so hard listening to his laughs and giggles while I studied in the next room. But that was just one of many sacrifices I and the rest of this cohort made to get here. Thank you for both being there during the hardest nights when sometimes both of us would be crying. I wouldn't have made it here without you. Mom, Dad, thank you for always believing in me and for raising me with a conviction of putting God first in everything I do, because what is meant for me was already written before I was even born. Everything I have today is by the grace of God. Thank you for being my role models as characters of unconditional love, resilience, humility, patience, and kindness. Thank you for the family you built. Lastly, to my husband, Ben Sr., what a year of growth for us, baby. Thank you for our son, Benny Jr., my boys. You are my everything, my motivation every time I wanted to give up. You challenge me to be better every day, and I couldn't have done this without both of you. I love you to the moon and back, and then beyond. The road deep, baby. Thank you.
All right, hello everyone. So I'm going to call the names of the Masters of Science in Nursing graduates. So could you all please come up to the front? Krista Martinez. Danielle Maston. Ronnie Joe Pinganaban. Jackie Stegerwald. Abigail Velasquez.
Well, this indeed is a very proud moment for all of us. Graduates, you are here this evening to be recognized and congratulated. I would like to encourage all of you to continue lifelong learning and to stay current in your practice and to always adhere to professional standards of nursing practice. Graduates, please stand and raise your right hand as we pledge the nursing oath together. I also invite all nurses that are present today to join in as well. You will find the nursing oath written on the last page of your program. Taking the nursing oath is our pledge to always perform at the highest level and to provide the best care possible to patients, families, and communities we serve. So here we go. Let's say it all together. In full knowledge of the obligation I am undertaking, I promise to practice professional nursing with all my skills and understanding I possess without regard to race, creed, color, politics, or social status of those entrusted to my care, sparing no effort to preserve quality of life, alleviate suffering, and to promote health as affirmed by the person. I will respect at all times the dignity and beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refraining from any action which may endanger life or health. I will endeavor to keep my professional knowledge and skills at the highest level and to give support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the profession.
All right. So at this time, we would like to recognize the members of the Roseman Nursing Honor Society. Students are eligible for membership as long as they meet requirements on or before the designated due dates. Students will have demonstrated superior academic achievement, academic integrity, and professional leadership's potential. The asterisk after a student's name in the program indicates that the student is a member of a nursing Roseman Honor Society, as do the gold and purple honor cords that members wear at graduation. Please stand as I call your name, face the audience, and remain standing until all students' names have been called. Maria Maybelline Cantos. Melly Klein Fortich. Ali Hayden. Please join me in thanking the 2023 Nursing Honor Society members for the various services they have provided to the community, the nursing profession, and to the Roseman University of Health Sciences. Thank you. You may sit.
The Critical Care and Emergency Student Nurses Association, or CESNA, was established to help students interested in the critical care and emergency nursing fields to have a platform to learn more about each specialty. The organization focuses on educating students through presentations from specialists, promoting nurse apprenticeship opportunities, and doing volunteer work for the local community. During a disaster, the advanced triage system utilizes a color coding scheme. Red tags are used to label those who cannot survive without immediate treatment, but who have a chance of survival. CESNA chose the color red to honor this system. That's my favorite color. Each CESNA member proudly wears the red cords to symbolize their devotion to the nursing profession. CESNA members, please rise as your name is called, face your family and friends, and remain standing until all of you have been called. Natalie Jean Brown. Maria Maybelline Cantos. Nina Kataag. McKenna Delaney. Claricel Felias. Melik Klein Fortich. Vin Ha. Ali Haydon. Brittany Hart Hanish. Veronica Jaramillo. Xingyue Kwang. Chandler May. Tara Tobias. Thank you.
Hello. This association promotes each member to build their leadership skills and conflict resolution through shared governance and community with respect for others. Student nurses in SNA and historical and current evidence. They are encouraged to take full advantage of their education and develop their professional leadership skills through collaborating with other members of the healthcare team and providing hands-on care to clients. The many activities participated in by these students develop continuous lifelong learning and ethics of the profession. These students known throughout the community for their hard work and compassion. I am very proud of the student who has demonstrated their integrity, compassion, humanity, and professionalism, and would like to recognize them today for their contributions to the community. Member, please stand as I call your name. Erica Pareda. Congratulations.
Aloha and mabuhay. I'm Dr. Mary Faye Axon Armstrong, Faculty Advisor for the Asian American Pacific Islanders Nurse Association, Roseman University Student Nurse Association, APINA RESNA for short. Our goal is to unify APINA nurses in Nevada and beyond. We aim to facilitate and promote networking, develop collaborative partnerships between nursing students, professional nurses, nurse researchers, nurse educators, advanced practice nurses, and community affiliates with the sole purpose of identifying the healthcare needs of AAPIs and optimizing resources to promote healthy living and better their lives. Students, please stand and face the audience as I call your name. Maria Maybelline Cantos. Inigo Jimenez II. APINA RASNA members participate in collaborative partnerships in providing community outreach events such as vaccination clinics, food distribution to those in need, and feeding the homeless population in our communities. Our hope is to instill the passion and purpose to all our nursing students and increase their cultural awareness. Please give the students your encouragement and support to persevere and serve our AAPI communities. Mahalo and thank you. Next, Global Health Student Nurse Association, or GHSNA. It was established in March 24, 2022. GHSNA strives to provide opportunities for all members to engage in meaningful community service locally, nationally, and globally. And by supporting community engagement beyond the classroom setting, facilitate and offer education about global health, and a commitment to build a just and peaceful society. GHSNA serves as a link to all nursing students and professional nurses for global health experiences. In the past years, Roseman nursing students and faculty have been involved with international mission trips to countries like Guatemala, Peru, and Uganda, Africa. Uganda Medical Mission Trip 2019 team founded a global nursing scholarship in June 2019 to help defray some costs for the students who are interested to join. Roseman College of Nursing Philippine Islands Medical Mission Trip 2023 team are scheduled to travel this coming December 2023 to the town of Binawanan, Rizal. Student, please stand up as I call your name and face the audience. Brittany Hanish. Please encourage our nursing students to get involved with international mission trips to learn about global nursing and how they can become patient advocates worldwide. Thank you. Brittany, you can have a seat. Thank you. Okay, next, RNPC scholars. At this time, I would like to recognize the graduate of the Registered Nurses in Primary Care program. The purpose of the RNPC Scholars Program is to recruit and train nursing students to practice to the full scope of their licensure in community-based primary care teams, both in rural and urban setting. RNPC graduate, please stand. Erica Johnson. The RNPC scholar, you can still stand up. The RNPC scholars received over 150 hours in primary care training. This included providing care within primary care settings in urban and rural settings in Nevada. The scholars were able to see the full impact of providing care within a team approach and developed an appreciation of the obstacles encountered by clients who sought care at primary care sites in rural Nevada. Again, congratulations to our RNPC scholar for their many accomplishments and contributions. Thank you.
At this time, I would like to recognize the graduate of the Maternal and Neonatal Student Nurse Association, or MANSNA. MANSNA was created by nursing students who want to prepare themselves for a career in women's health, obstetrics, and neonatal health. The goal is to inspire and work collaboratively to improve maternal and neonatal health outcomes as future nurses. Each month, they provide education and activities that will help students gain knowledge that will help them in their nursing careers. As I call your name, please stand to be recognized. Mary DeMano. Congratulations.
Good evening. You guys got to do better than that. Good evening. I like that. All right. Hello, everyone. Congratulations, students. I'm Dr. Eric Dillon, the advisor for the LGBTQ Student Association. The mission of the Roseman University of Health Sciences LGBTQ Student Association is to create a safe and a supportive environment for university students identifying as LGBTQ and their allies for the purpose of creating a sense of community within, to work to create a positive image for LGBTQ healthcare workers and the community at large, as well as to promote overall health and wellness of LGBTQ students. As a member of the LGBTQ Student Association, members participate in various events that include educational lecture series, fundraising efforts, as well as the annual Pride events here in the Las Vegas Valley. I am very proud of these students and their contributions to bringing awareness to issues concerning the LGBTQ+ community, particularly in healthcare. Will the member of the LGBTQ Student Association please stand as I call your name? Brittany Hanish. Thank you and congratulations.
Now it's time for the Spirit of Nursing Award. The recipient of the Spirit of Nursing Award participated in various community and school activities, such as planning, advertising, and executing fundraising events to raise funds for the cohort and St. Rose Sienna volunteer. The recipient had firsthand experience with the adrenaline rush that comes with performing activities during a code situation and applying skills that were taught in nursing school. The recipient also enjoys talking to patients, spending time getting to know them and their stories. This recipient has a real passion for nursing and loves to work on assignments like the nursing care plan. During one of the recipient's apprenticeships, the recipient took care of a patient that for almost 1 month. The patient was in the unit waiting for a spinal surgery and was frequently complaining about pain, which was affecting the patient's ability to continue with activities of daily living. Living in Nevada, where cannabis is legal, the patient had managed to sneak cannabis gummies into the unit and was taking them randomly along with their medications. Because this is not allowed, the nursing staff took away the gummies from the patient. The patient was devastated, constantly using the call light and screaming about pain and general discomfort. To help the patient's pain, the recipient took the time to sit and talk to the patient, asking to hear stories and hobbies. The patient had recently lost a family member and now lives alone. The recipient also learned that the patient loves the music of Elvis Presley. Whenever the patient would complain about pain, the recipient would play Elvis Presley songs and would sing along with the patient. This helped alleviate the pain without any medications. Eventually, the patient was ordered to be transferred to a rehabilitation center. During the discharge process, the patient and the recipient played and sang one last Elvis Presley song. This experience made a huge impact on the recipient, who was reminded of the importance of compassion in nursing. The recipient is a member of the Honor Society, Cessna, SNA, and the ABSN June 2022 Treasurer. The recipient of the Spirit of Nursing Award is Malik Fortish. If you would like to come up, please come up and accept your award. Let's give her some applause. And congratulations.
They really took away his gummies. That's just mean, man. Taking away gummy bears. The recipient of the Dean's Award has participated and collaborated in a broad range of community programs, including Safe Kids Trauma Prevention Education Program, Asian American and Pacific Islander Heritage Month, Boys and Girls Club, and Vigilant for Blood Drive, and has also helped raise money for nonprofit organizations. One day during a clinical rotation, the recipient encountered a patient who was confused and crying. The recipient assessed the patient and asked about their pain. They listened carefully, continued the focused assessment, palpated the abdomen, revealed a distended bladder. It turned out the patient has an ileostomy, which was covering the distended bladder. The recipient communicated these findings to the mentor and suggested a bladder scan, which further reinforced the finding of urinary retention. As a result, the nurse and the recipient called the attending provider using the Situation Background Assessment and Recommendation Framework, which is taught in nursing school, and obtained an order for a catheterization. The use of the catheter immediately decreased the pain and made the patient more comfortable. The patient thanked the recipient for the thorough assessment, which actually accurately identifies the cause of the pain, and for acting on assessment promptly. The recipient treated the patient with competence, kindness, and empathy. In gratitude, the patient wrote a letter of appreciation, which was given to the clinical instructor. The experience made a huge impact on the recipient, who promised to continue the compassionate care that nursing is known for. The recipient is a president of the Asian American Pacific Islander Nurses Association, RU Nurses Association, former president of ABSN June 2022, and a member of the Student Nurses Association. The recipient is hereby, Dean's Award is hereby awarded to Mr. Jose Inigo Jimenez VII. So as I was reading that whole little story, I couldn't help but think about how the faculty are all debating whether or not we should give you bathroom breaks during assessments. And all you gotta do is pee. I just gotta pee. It hurts. Can I just go pee? So it just made me laugh in my head. But as I digress. So as we complete the formal part of our ceremony, I'd like to share a few more parting words with the graduates, since this is the last time I'll have your attention as a group, as though I ever had it in the first place. But I like to think I do for a brief nanosecond at orientation. So you represent the future of our profession. I challenge you to ask yourself each and every day, how should I be, not what should I do? I ask you to think about your character, your values, your virtues, your ability to act outstandingly. Let your why shine through. Your journey of discovery does not end here. Continue to ask yourself in each new challenging situation, how should I be? You have mastered the 5 rights of medication administration. And yes, I know there might be more, but 5 fits better with my speech, so I'm going to leave it at that. But I want to leave you with a new set, and that is always act at the right time regarding the right thing, toward the right person, with the right intention, and in the right way. Now you can be the role model for those you interact with and care for. As you go forth and be fruitful, remember, watch your thoughts, they become words. Watch your words, they become actions. Watch your actions, they become habits. And watch your habits, they become character. And watch your character, for it becomes your destiny. And I hope your destiny shows you great things. I hope you wear your pin proudly. I found mine recently. It's from UNR, right? So if you're like me, you'll put it in a drawer for 30 years, and then you pull it out one day, and you go, oh my God, that was such a traumatic experience. Let me just put that back in the drawer. Forget all about it. No, but really, I wish you guys the best. You guys are a wonderful class. Thank you all for attending this very special event this evening. You've made it special for all of us. The students could not have completed this rigorous program without your love, support, and encouragement. And students, please rise and let's welcome and thank our families and loved ones, because we know how important it is to have that support to get through nursing school. "16 months of not letting you pee for 2 hours at a time." So I'd ask the audience to please remain seated briefly. We're going to proceed out. As soon as the students are out, they'll turn around and come right back in. And then please join us in the back for refreshments afterwards. And you can cue the music.